My name is Alex Knutson. I'm currently in the nursing school at the University of Minnesota. I'm studying informatics, which is healthcare technology, and how to incorporate that best into healthcare. I had a nursing faculty kind of inspire me to start pursuing it when I was going through nursing school as an undergrad. And she convinced me, Bonnie Wester convinced me to join the program, and that's how I got here. Yeah, I love it so far. I've been in it for a year now, almost. And all the classes are exactly what I wanted to do. The experiences are exactly what I wanted to do as a job. I was hired by Hennepin Health, which is the safety net accountable care organization for Hennepin County Medicaid patients. So patients that are on Medicaid are taken in as their health plan by Hennepin County with Hennepin Health in a lot of cases. And I'm working with them on analyzing their population and finding interventions that are going to work well for Hennepin Health patients. It's mostly numbers on a computer, looking at the database with all Hennepin Health patients and comparing patients that are mental health right now as my project versus patients that are do not have a mental health diagnosis. So it's looking at the differences between mental health and non-mental health patients and how we can provide better services to our mental health patients, helping them after their discharge from inpatient care or helping them connect with new resources that might be unique to the mental health population. My professor knew about HUP, and I hadn't actually heard of it before. I had been looking for an informatics-related job for a little while, and as the school year started, she recommended that I apply for it, and that's how I came to know HUP and came to Hennepin County. It's good. I think I've been here about 3 or 4 months at this point. I feel like I have a really good handle on what Hennepin Health does in the population, and that really helps in my role as an analytics person to figure out what the factors of this population are and what kind of resources are available. Yeah, the data I'm working with is real data about Hennepin Health patients, and it's really exciting because all of the work I'm doing is going to be going into future projects even after I'm not here as an intern anymore. So it's exciting to see the things you're doing in school translate directly into the real world. In school, I've taken classes on databases and programming, but when I started at this internship, I really solidified those. So now I have a lot more database and SQL experience, and I feel like I really understand how to interact with those technologies more than I ever did in school. I also have programming experience being incorporated into the internship, allowing me to create programs that they're going to use in the future, which is not something I've ever done before. So it's translating kind of the hard skills I've learned in school directly into the workplace. I think Hennepin Health has done a great job of really allowing us a lot of freedom in our role. So I've learned a ton about time management and how to manage my projects and my goals for the week and for the month, and moving on to the next presentation or meeting. I think that's been really key because there's so much freedom as part of this internship, and they really understand you as a student and understand you have other commitments. So it's on you to manage your time and to make sure you're getting your projects done when they need to be. Presentations are done both at HCMC and with Hennepin County, talking to directors of different programs or chief information officers in some cases about the work that I've done so far and kind of next steps, and talking with them about the larger perspective of where to go with our projects, which is very exciting. It gives you a lot of perspective on how a workplace like that works because, people like me who are doing the analytics work, the chief executive officers and everyone are really interested in that data, and they want to take that data and incorporate it in with other projects that they're thinking about. And so you really see how my small portion of work is contributing to everyone's work. I think that working here has really been a learning experience for me about the kinds of patients that are Hennepin Health patients and the types of people that are underrepresented and sometimes minority groups. And so I feel like the work that we're doing here is really going a long way to improving the health of people who in general have lower quality of health than other residents in the county. And so it's really exciting to be able to see the new programs and resources that are being implemented for these patients. And I feel like every little bit of work I'm doing is going to lead to perhaps better outcomes for these patients in the future. I did not know about Hennepin Health before I started. This was a whole new experience for me, and as I've even been here, there's been a New York Times article published about Hennepin Health, and really exposing it to other parts of the country and the world. So that was exciting to see all the work they've done in the past really culminating in something big. I think the biggest thing is just how much Hennepin County really cares about its residents and wants to provide the best resources and the best programs to residents, especially residents that maybe are having lower quality of life because they don't have access to as many resources. So working at Hennepin Health has shown me how much the county really cares about this population and how much they've invested in improving their health overall. Overall, I've learned a lot about how analytics work is done in general. I've learned a lot about databases, but not just the hard technical areas, but also how to take that information and boil it down into a good presentation to give someone information that they can take into their work. So I think that has been a really key part of being here. I've also learned so much about the technology behind how HCMC, for example, is monitoring their patients and looking at the data about their patients over time. This is my first informatics experience as a job, and so it was really exciting to be able to take the things I've used in class and see how they're actually applied, see what portions of classes are useful and less useful. And it was, I think from this job, I'll take forward a lot of information and knowledge about how analytics is done in the future and how programs like this are managed in general, I guess. Before I had started this job, I wasn't sure. And since being here, I've really come to love the analytics work that I've started doing. So at this point, I'm thinking that when I graduate from school, I'll probably pursue something in the analytics sort of realm. It fits really well into nursing informatics and how nurses think about information and then how they can apply that to a patient population. And so, yeah, that's a big takeaway for me. You don't know until you get to try something and then you grab onto the things that you really end up liking in the real world, because in school they're completely different. I think when people think about analytics, they think about someone just staring at a computer and numbers running by, but that's not really the way it works in the workplace. You're presenting to people, you're talking about ideas, you're problem solving, different ways to solve the big problems that are part of an organization. And so, yeah, that part is a lot more exciting than I thought it would be. I think I'd just like to say how thankful I am for HUP and the partnership that the university has with Hennepin County, because this internship was really a great starting point for me as I'm starting graduate school, and I think it's gonna help me move a long way towards other nursing informatics jobs in the future.